You spend roughly a third of your life lying down asleep. Over a typical 75-year lifespan, that adds up to something like 25 years spent horizontal, unconscious, and completely unaware of what your body is doing. And the position your body settles into during those hours isn't just about comfort. It genuinely affects how well your heart, your lungs, and your brain function overnight. If you've spent any time on social media, you've probably run into videos claiming that the wrong sleep position is silently starving your brain of oxygen, that stacking pillows is waterlogging your skull, or that stomach sleeping is quietly damaging your arteries every single night. Some of these videos borrow real scientific terms, real study names, and real anatomy, and then stretch them into conclusions the actual research doesn't support. That's frustrating, because there's genuinely useful, well-documented science on sleep position buried underneath all that noise, and it deserves better than fear-driven exaggeration. So I want to walk you through what sleep researchers, cardiologists, and physical therapists actually know about sleep position, not exaggerated claims, not scary hypotheticals, but the real, well-documented mechanisms, with honest caveats about what's strongly supported and what's still being studied. By the end of this video, you'll understand exactly which habits are worth changing, which ones are harmless despite the internet scare stories, and 2 positions that genuinely have solid research behind them. Before we start, quick question for you in the comments. Are you a back sleeper, a side sleeper, or a stomach sleeper? I'll come back to each of those as we go, so it helps to know where you're starting from. Let's get into it. Why position matters. More as you get older. Here's the honest starting point. In your 20s and 30s, your blood vessels are more elastic, your blood pressure regulation responds quickly, and your body compensates easily for whatever position you fall asleep in. You could sleep twisted like a pretzel and wake up with nothing worse than a stiff neck. As people age, arteries naturally become a little stiffer, and the autonomic nervous system, the system that manages blood pressure moment to moment, responds a bit more slowly, especially during sleep. This is well established in cardiovascular research. It doesn't mean something is wrong with you. It means your margin for compensating gets a little smaller, which is exactly why sleep position becomes more relevant with age, even though it was basically irrelevant when you were younger. One real, well-documented phenomenon is called nocturnal blood pressure dipping. In healthy sleep, blood pressure naturally drops somewhat during the night compared to daytime levels. This is normal and considered protective for the cardiovascular system. People whose blood pressure fails to dip properly at night, sometimes called non-dippers, and in more extreme cases, reverse dippers, where pressure is actually higher at night than during the day, have been shown in research to carry higher long-term cardiovascular risk. This isn't a fringe finding, it's a well-established area of hypertension research that many cardiologists now consider when evaluating patients, sometimes using 24-hour ambulatory blood pressure monitors specifically to check whether a patient's blood pressure is dipping normally overnight. Sleep quality, sleep position, and habits like late alcohol use, late heavy meals, and poor sleep environment can all influence this dipping pattern to varying degrees. That's the real evidence-based thread connecting everything in this video, not dramatic overnight stroke warnings designed to scare you into watching another 5 minutes, but the steady, cumulative effect of how well your cardiovascular system actually gets to rest each night. It's also worth saying clearly, none of what follows means that if you've slept a certain way for 30 years, something catastrophic is brewing. Bodies are resilient, and most people sleep in a mix of positions every night without ever realizing it. Studies using motion sensors have found that most adults shift position anywhere from 10 to 40 times per night, cycling through back, side, and sometimes stomach sleeping, without waking up enough to remember it in the morning. So this isn't about achieving some perfect, rigid sleep posture. It's about understanding which tendencies are worth nudging in a better direction, and which ones simply aren't worth worrying about. Let's go through the positions and habits one at a time. Sleeping flat with no elevation. Sleeping completely flat with little or no head elevation is extremely common, and for most healthy people, it's simply fine. I want to be upfront about that instead of manufacturing a problem that isn't there for everyone. That said, there are specific groups where a slight elevation genuinely helps. People with acid reflux, GERD, lying flat lets stomach acid travel back up the esophagus more easily. Elevating the head of the bed, not just stacking pillows but raising the actual upper body on an incline, is a standard doctor-recommended intervention for nighttime reflux. People with obstructive sleep apnea or heavy snoring, elevation can help keep the airway slightly more open, which may reduce apnea events for some people, though it's not a substitute for proper apnea treatment like a CPAP machine if that's been prescribed. People with certain circulation issues in the legs, where a completely flat position isn't the concern, leg elevation, not head elevation, tends to be recommended there instead. If none of that applies to you, sleeping flat isn't something you need to fix. It's the position most humans have slept in for most of history, and for the majority of healthy adults, it remains a completely reasonable default. If one of those does apply, a wedge pillow or an adjustable bed base that lifts the torso 15 to 30 degrees is the standard, evidence-supported approach. Much better than stacking 2 or 3 regular pillows, which brings us to the next point. One thing worth mentioning here, because it comes up a lot in comment sections. You may have seen claims online that flat sleeping raises intracranial pressure and causes brain damage in older adults through some mechanism involving cerebrospinal fluid. There is genuine research on head positioning and intracranial pressure, but it comes almost entirely from clinical settings involving patients with brain injuries, post-surgical patients, or people in intensive care, where doctors are managing measurable, often dangerous swelling. Extrapolating that research to you personally sleeping flat in your own bed tonight isn't something the underlying studies actually support. If you don't have a diagnosed neurological condition, this isn't something to lose sleep over, no pun intended, stacking multiple pillows under your head. This one is worth talking about because so many people do it with good intentions, trying to manage reflux, congestion, or snoring. And it can create a different problem. When you stack several pillows under just your head, your neck bends forward sharply while the rest of your torso stays flat. That's very different from elevating the whole upper body on an incline. Sustained forward neck flexion overnight can lead to genuine neck strain and stiffness, and some people do report morning headaches or a feeling of grogginess that improves once they switch to a single, properly contoured pillow instead of a stack. The fix is simple and doesn't require throwing away your reflux management. It just means changing how you elevate. A cervical support pillow, or better yet, an adjustable bed base or foam wedge that lifts your whole upper body, achieves the reflux and airway benefits without forcing your neck into an unnatural angle all night. If you're currently sleeping on a stack of 2 or 3 pillows, that's genuinely one of the easiest changes to make, and a lot of people notice a difference in neck stiffness within about a week. A practical way to test whether your pillow height is causing you problems: lie on your back in bed and have someone take a quick photo from the side or check in a mirror. If your chin is angled noticeably down toward your chest rather than your neck staying roughly in line with your spine, your pillow stack is probably too high. Physical therapists often use this same simple visual check with patients who come in with chronic morning neck stiffness, and it's a far more reliable indicator than any dramatic claim about fluid buildup in the skull. When people switch from multiple flat pillows to a single supportive pillow shape to fill the gap under the neck's natural curve, the improvement in morning stiffness tends to be noticeable within days rather than weeks, simply because the muscles around the neck are no longer fighting an awkward angle all night. Stomach sleeping. Stomach sleeping is one of the more debated positions in sleep medicine, and I want to give you the real picture rather than either extreme. The clearest, best documented issue with stomach sleeping is neck and spine strain, not a dramatic blood flow crisis. When you sleep face down, you have to turn your head to one side to breathe, which means your neck stays rotated for hours. Physical therapists and sleep specialists commonly link habitual stomach sleeping to chronic neck pain, shoulder discomfort, and lower back strain, because the position also tends to flatten the natural curve of your spine. There's also a breathing mechanics point worth knowing. Lying face down with your chest against the mattress somewhat restricts how fully your rib cage can expand, meaning breaths tend to be a little shallower than in other positions. For most healthy people, this isn't a major concern, but if you already have a respiratory condition, it's one more reason side or back sleeping tends to be recommended by sleep specialists. If you're a committed stomach sleeper and don't have neck, back, or breathing issues, you don't need to panic and force a total change overnight. Plenty of people sleep this way their whole lives without major problems, especially if they don't hold the position rigidly all night and shift around naturally. But if you regularly wake up with a stiff neck or lower back pain, stomach sleeping is a very reasonable first thing to experiment with changing, and a body pillow can make the transition to side sleeping much easier, which we'll get to shortly. A common tip from physical therapists for stomach sleepers who aren't ready to fully switch positions: place a thin pillow under your pelvis and lower abdomen. This slightly reduces the arch in your lower back and can ease some of the lumbar strain that comes with stomach sleeping, even if you're not ready to give up the position entirely. It's also worth noting that stomach sleeping is generally discouraged for infants specifically because of a completely different and much more serious concern: sudden infant death syndrome risk, which is why back to sleep is standard guidance for babies. That guidance is about infant physiology and doesn't transfer to adults. I only mention it because it's sometimes cited out of context to make adult stomach sleeping sound more dangerous than the evidence actually shows. Right side sleeping and heart function. This is a genuinely interesting one, and it's more nuanced than right side bad, left side good. For most healthy people, sleeping on either side is perfectly fine, and your body will naturally shift positions many times throughout the night regardless of what you started in. That's normal and not something to fight. Where it gets more specific is for people with diagnosed heart failure or significant cardiovascular disease. There is published research, including studies looking at patients with heart failure, suggesting that many of these patients naturally gravitate away from right-side sleeping and report more comfort on their left side. The proposed explanation involves how the heart sits in the chest and how the body's major veins return blood to it. Lying on the left may slightly ease that return process for a heart that's already working harder than normal. This research is specific to people with existing heart conditions. It's not evidence that right-side sleeping harms a healthy heart. If you have a diagnosed cardiovascular condition, this is worth mentioning to your cardiologist, since they may already be aware of it or have specific guidance for your situation. If you don't have a heart condition, this isn't something you need to worry about. There's an interesting side note here too. Some people with heart failure report a symptom called paroxysmal nocturnal dyspnea, sudden shortness of breath that wakes them up, usually an hour or two after falling asleep, often relieved by sitting upright. This is a recognized symptom pattern in heart failure and is something patients are specifically taught to watch for and report to their doctor. It's a good example of a real, clinically meaningful nighttime symptom, very different from vague claims about silent oxygen restriction that supposedly no doctor mentions. If you, or someone you know, experiences sudden nighttime breathlessness like this, that's a conversation to have with a physician, not something to try to diagnose from a video. The tightly curled fetal position. The fetal position, knees drawn up, shoulders curled in chios, is one of the most common sleep positions, especially for people who tend to feel cold or who find it emotionally comforting. There's nothing inherently wrong with side sleeping with your knees bent. In fact, that's part of what makes the next section's recommendation work well. The issue is specifically with a very tightly curled version, chin tucked hard into the chest, knees pulled all the way up, spine strongly rounded. In that tightly curled form, two things tend to happen: restricted breathing. A strongly compressed ribcage limits how deeply you can breathe, similar to the stomach sleeping issue. Joint and circulation strain. Tightly bent knees and hips for hours can contribute to stiffness, and in some people, discomfort in the legs by morning. The fix isn't to abandon side sleeping, it's to loosen the curl. A body pillow between your knees keeps your hips more open and your spine in a more neutral line, giving you the comfort of side sleeping without the tight compression. If you tend to wake up with your hands or feet feeling numb or tingly after sleeping curled up, that's often related to nerve or blood vessel compression at the wrist, elbow, or knee, rather than anything happening centrally in your brain or heart. Loosening the curl and keeping joints in a more neutral position overnight often resolves this on its own. If numbness or tingling persists regularly regardless of position or is only on one side, that's worth mentioning to a doctor, since it can occasionally point to issues like nerve entrapment that are easily treatable once identified. Eating and drinking close to bedtime. This is the habit with the most consistent research behind it, and it's worth taking seriously. Large meals close to bedtime. After eating, your body directs more blood flow toward digestion. This is a completely normal process, but it also means your digestive system is more active right when you're trying to wind down for sleep, which can contribute to poorer sleep quality, reflux, and discomfort, especially with heavy or fatty meals. Most sleep and nutrition guidelines recommend finishing your last substantial meal roughly 2 to 3 hours before bed. Alcohol before bed. This is genuinely well-studied territory, and the findings are fairly consistent. Alcohol may help some people fall asleep faster initially, but it disrupts sleep architecture later in the night, reducing REM sleep, increasing awakenings, and worsening snoring and sleep apnea symptoms in people prone to them. Research has also shown that alcohol consumed close to bedtime can blunt the normal overnight blood pressure dip we talked about earlier. Over time, poor quality alcohol-disrupted sleep is linked with worse cardiovascular outcomes. Not because of one night, but because of the cumulative pattern. The practical recommendation from sleep specialists is fairly consistent. If you drink, try to stop at least 3 to 4 hours before bed, and consider a short, easy walk after dinner. Light post-meal movement is genuinely shown to help regulate blood sugar and ease digestion before you lie down, and doesn't need to be anything intense. A relaxed 10 to 15-minute walk around the block is enough to make a measurable difference for most people. Caffeine deserves a mention too, even though it's a separate issue from alcohol. Caffeine has a half-life of roughly 5 to 6 hours in most adults, meaning a cup of coffee at 4 p.m. can still have half its stimulating effect in your system at 10 p.m. Sensitivity varies a lot from person to person, but if you struggle with sleep onset, an early afternoon cutoff for caffeine is one of the more reliably effective changes people can make, according to sleep medicine guidelines. Large, spicy, or high-fat meals close to bedtime are also worth flagging separately from reflux because they take longer to digest and can keep your digestive system more active later into the night, which for some people translates into more restless, lower-quality sleep even without noticeable heartburn. The 2 positions worth trying. Left side sleeping. Left side sleeping has more research support behind it than any other single sleep position, for a few distinct reasons. Pregnancy. This is actually where the strongest evidence exists. Left side sleeping is the standard recommendation for pregnant women in the 2nd and 3rd trimester because it improves blood flow to the uterus and reduces pressure on the body's major vein returning blood to the heart. Acid reflux. Multiple studies have found that left-side sleeping reduces nighttime reflux symptoms compared to right-side or back sleeping. This is one of the more consistently replicated findings in sleep position research. The glymphatic system. This is a genuinely fascinating and relatively recent discovery in neuroscience, a waste clearance system in the brain that becomes more active during sleep, flushing out metabolic byproducts. A widely cited 2015 study, conducted in rodents, it's important to note, found that this clearance system appeared to function most efficiently during side sleeping compared to back or stomach sleeping. It's an exciting area of ongoing research, though it's worth being honest that most of this specific finding comes from animal studies, and researchers are still working to confirm exactly how it translates to humans. Put together, left-side sleeping has real, multi-source support, not as a guaranteed fix for any specific condition, but as a generally well-supported default position, especially if you deal with reflux. Let me linger on the glymphatic system point for a moment, because it's genuinely one of the more remarkable discoveries in recent neuroscience, and it deserves to be understood accurately rather than sensationalized. The glymphatic system was formally described around 2012 by researchers at the University of Rochester, led by neuroscientist Mike Nedergaard. It functions somewhat like a waste management system for the brain, using the flow of cerebrospinal fluid through the spaces around brain cells to help clear out metabolic byproducts that accumulate during waking hours, including proteins like beta amyloid, which is associated with Alzheimer's disease when it builds up in excess over many years. The 2015 study on sleep position and glymphatic clearance that gets cited so often was conducted in anesthetized rodents using imaging techniques that aren't practical to perform on awake humans, which is exactly why researchers haven't been able to directly replicate the same measurements in people yet. That doesn't make the finding meaningless. Animal studies like this one are often the first step toward understanding a system before human research catches up, and there's genuine, active scientific interest in confirming how this translates to human sleep. But it does mean the honest, accurate statement is, an early and promising finding in animal research suggests side sleeping may support brain waste clearance. Not scientists have proven side sleeping prevents Alzheimer's, which is an overreach the actual research doesn't support. If you're not used to side sleeping, a full-length body pillow to hug or lean against, plus a pillow between your knees, makes the transition much more comfortable and helps prevent you from rolling onto your stomach overnight. Give it a genuine trial period, a week or two, since almost any new sleep position feels a little unfamiliar for the first few nights before your body adjusts. Back sleeping with slight elevation. For people who genuinely can't tolerate side sleeping, due to shoulder arthritis, hip pain, or just decades of habit, back sleeping with a modest upper body elevation is a solid, well-supported alternative. The key word is modest. Somewhere around 15 to 30 degrees of elevation, achieved with a wedge pillow or an adjustable bed base, offers real benefits. It can ease reflux symptoms, similar to left-side sleeping. It tends to keep the airway slightly more open, which may help with snoring and mild sleep apnea. Combined with a small pillow under the knees to maintain your lower back's natural curve, it distributes body weight more evenly and reduces pressure points. This is a genuinely good option, and it doesn't require abandoning back sleeping altogether, just adjusting the angle. One caveat worth knowing, for a subset of people, back sleeping can actually worsen snoring and obstructive sleep apnea, because gravity allows the tongue and soft tissues at the back of the throat to fall backward and partially block the airway. This is exactly why elevation matters so much for back sleepers specifically. It's not just about comfort, it's a genuine mechanical adjustment that helps counteract that tendency. If you snore heavily on your back regardless of elevation, or if a partner has ever mentioned you seem to stop breathing briefly during sleep, that's worth bringing up with a doctor, since sleep apnea is both common and very treatable once properly diagnosed, usually starting with a sleep study. Quick answers to common questions. Before we move on, let me address a few things that come up constantly in comment sections whenever this topic comes up. I move around all night. Am I doing this wrong? No. As mentioned earlier, this is completely normal. Sleep studies using overnight motion tracking consistently show that healthy sleepers change position many times per night, often without any memory of it the next morning. What matters more than the position you fall asleep in is whether you're consistently ending up in a position that causes you pain, breathing difficulty, or a specific symptom you can point to, not whether you technically start the night in the ideal posture. Can changing my sleep position lower my blood pressure? Sleep position alone isn't a treatment for high blood pressure, and no legitimate source should present it that way. What the research actually supports is more modest. Certain positions can support better sleep quality, reduce reflux, and in specific patient populations, like heart failure patients, may ease some cardiovascular strain. If you have diagnosed hypertension, medication, diet, exercise, and your doctor's guidance remain the primary tools, sleep position is a supporting habit, not a replacement for medical treatment. Is it bad to sleep with a pet on the bed, and does that affect position? This mostly comes down to personal comfort and whether it disrupts your sleep quality through movement or allergens, rather than anything specific to cardiovascular position mechanics. If a pet is causing you to sleep in an awkward, cramped position every night or is fragmenting your sleep with frequent waking, that's worth addressing for sleep quality reasons generally. What if none of these positions feel comfortable to me? Comfort matters. If a recommended position causes you pain or you simply can't fall asleep in it, forcing it isn't worth the trade-off, since poor, restless sleep in a technically ideal position is worse for your health than good, restful sleep in a less ideal one. Sleep quality and consistency matter enormously, arguably more than the exact angle of your body. Your sleep environment matters too. Position isn't the whole story. A few environmental factors have strong research behind them. Temperature. Most sleep researchers recommend a bedroom temperature somewhere in the range of 65 to 68 degrees Fahrenheit for optimal sleep. Cooler temperatures help your core body temperature drop, which is part of the natural physiological trigger for deep sleep. Light and screens. Blue light exposure from phones and tablets in the hour or two before bed suppresses melatonin production, which can delay the onset of deep sleep. This is one of the most consistently replicated findings in sleep science. Reducing screen time before bed, or at minimum using night mode settings, genuinely helps most people. Noise. Even sounds that don't fully wake you can cause brief micro-arousals that interrupt deeper sleep stages without you consciously noticing. A consistent, low white noise environment or earplugs can help minimize this for people in noisy environments. Mattress and pillow support. An overly soft or sagging mattress can cause your spine to fall out of a neutral position regardless of which way you're facing, and an unsupportive pillow undermines a lot of the neck benefits we talked about earlier. You don't need the most expensive option on the market, but a mattress that's more than 8 to 10 years old, or one that visibly sags in the middle, is worth reconsidering if you're dealing with ongoing back or neck discomfort. Consistency of sleep and wake times. This is less about position and more worth mentioning because it has some of the strongest research behind it in all of sleep science. Going to bed and waking up at roughly the same time each day, including weekends, helps regulate your circadian rhythm, which in turn supports more consistent, higher quality sleep overall. Irregular sleep schedules have been linked in research to worse cardiovascular outcomes independent of total sleep duration. Tracking your sleep if you're curious. For people concerned about sleep apnea or oxygen levels, an overnight pulse oximeter can be a useful, low-cost way to gather information, and wearable sleep trackers have gotten reasonably good at estimating sleep stages and disturbances. But any concerning readings are a conversation for your doctor, not something to self-diagnose from. If you snore heavily, wake up gasping, or feel excessively tired despite adequate sleep time, that's worth bringing up with a physician, regardless of what any device shows, since sleep apnea is common, significantly underdiagnosed in the US, and very treatable once identified, often with a home sleep study that's far less involved than people expect. Bringing it all together. Here's the honest summary. Most sleep positions are not dangerous for most healthy people. Your body is more adaptable than internet headlines give it credit for. But if you're dealing with specific issues like reflux, snoring, neck pain, or a diagnosed cardiovascular condition, there are genuinely well-supported specific adjustments that can help. If you deal with reflux or snoring, try left side sleeping, or back sleeping with a 15 to 30 degree elevation. If you wake up with a stiff neck, consider swapping stacked pillows for one supportive pillow, or gradually shifting away from stomach sleeping using a body pillow. If you have a diagnosed heart condition, mention your sleep position to your cardiologist. It's a legitimate, evidence-based thing to discuss. Regardless of position, finishing meals a few hours before bed, limiting alcohol close to bedtime, keeping your room cool and dark, and reducing screen time before sleep all have solid research behind them and matter more, cumulatively, than the exact angle of your body. You don't need to overhaul everything tonight. Pick one thing from this list that actually applies to you, and try it consistently for a week or two before judging whether it's making a difference. Small, evidence-based adjustments, not dramatic overnight fixes, are what tend to actually stick and actually help over the long run. And I want to end with the same honesty I tried to bring to the whole video. Sleep position is a genuinely useful thing to pay attention to, but it's one piece of a much bigger picture that includes diet, exercise, stress management, regular checkups, and GL for anyone with a diagnosed condition solves, following your doctor's specific guidance. No single video, including this one, should be the final word on your health. If anything here made you curious or a little concerned about a specific symptom, the right next step is a conversation with your physician who can actually examine you, review your history, and give you advice tailored to your situation in a way no general video ever could. If you found this useful, let me know in the comments which position you're currently using and whether you're planning to try anything differently. I read through the comments regularly, and it genuinely helps to know what people are actually dealing with. So don't hesitate to share your own experience, even if it doesn't perfectly match anything covered here. And if you know someone who's been waking up with unexplained neck pain, morning headaches, or reflux, feel free to pass this along. A lot of this comes down to simple, fixable habits that nobody ever really sits down and explains clearly, buried instead under either medical jargon or internet exaggeration. Thanks for watching, and I'll see you in the next one.